Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
What causes a urinary tract infection?
Well, usually the urine is sterile. That means there are no bacteria in the urine. But sometimes bacteria can enter from the skin. They go through the urethra and get into the bladder. If it's an infection in the bladder, it's known as cystitis. Sometimes, if that infection continues to go up through the bladder, through the ureters, and up to the kidney, it's known as pyelonephritis.
Are they common in children, and why?
They are common in children. We say that roughly 3% of girls and 1% of boys will have a urinary tract infection by age 11. Now, certain populations of kids are at higher risk. Girls, because they have a shorter urethra, are at higher risk for urinary tract infections than boys when they're young. In addition, boys who are uncircumcised are at higher risk for infection.
How might a parent know if their child has a UTI?
Most UTIs are asymptomatic. That means children will not have any symptoms. But frequently, for more severe infections, a child may develop a fever greater than 101 degrees Fahrenheit. At other times, they'll have symptoms such as frequency of urination, urgency, burning, pain in the abdomen, or pain in the sides, also known as the flanks. Sometimes they'll have nausea or vomiting too.
How can a UTI be treated?
Usually urinary tract infection is treated with an antibiotic. In some children, these infections are associated with other conditions such as constipation and what we call dysfunctional elimination and voiding. These children would benefit from a regimen that will improve their constipation and improve the way that they urinate and empty their bladder. Our clinic here at the University of Massachusetts and at UMass Memorial does address these issues.
Are UTIs preventable?
UTIs are preventable in children with dysfunctional elimination and constipation.
When should a parent consult a pediatric urologist for UTI infection?
Well, you should first go through your pediatrician if you suspect your child has a urinary tract infection. But if they're diagnosed with a urinary tract infection and they've had high fever, then you should definitely be seeing a pediatric urologist to start screening for other urologic conditions such as vesicoureteral reflux, also known as urinary reflux.